So with that, I would like to introduce, I have to think about it for a minute, Dr. Bob Lutz. Dr. Bob Lutz is the health officer for Spokane Regional Health District since June 2017, but he's no stranger to Spokane Regional Health District. Dr. Lutz served 8 years on the district's Board of Health and is a practicing urgent care physician for Multi-Care Rockwood Clinic. In his role as health officer, he provides leadership for the protection of public health, enforces public health regulations, and serves as an advisor to elected officials on community health and safety. And I know Bob is doing a phenomenal job at Spokane Regional Health District, and I think he is a leader within our healthcare system in our region and around the state around healthcare. So I'm really excited to have an opportunity to introduce him to you today and to hear his thoughts on Spokane Regional Health District and the role that they play and the role that the Healthcare Coalition plays. Dr. Lutz.
Well, good afternoon and thank you. I mean, Ed pretty much said all you need to know about me. But yeah, I'm a family medicine doctor by training. I've been an urgent care physician off and on for about 30 years. Came to Spokane about 14 years ago and have been on the Board of Health for about 8 years until I was appointed as a health officer back in June of last year. People oftentimes ask me when I introduce myself, they say, what is public health? And what do you do as a health officer? And what I sort of will tell them is that I'll use a definition of public health from the Institute of Medicine out of 1988. It essentially says that, and I'm going to quote it, don't have it completely memorized, but it's what we as society do collectively to assure the conditions in which people can be healthy. So when I see that definition, I look at two words that for me really stand out. First of all, it's society. And second of all, it's a collective effort. So I think many look upon public health. I mean, first of all, we're in Spokane. They look at that really unusual looking building in front of the courthouse and they say, what happens in that strange kind of fortress? Well, I think all of you know what public health does. I mean, we are the governmental arm of public health, but I will say that at some level, we're sort of the intersection between the public and maybe public safety as we know it. And public safety, I mean, we know the fire departments and we know about police because they wear uniforms. We wear these uniforms. But we're also at that intersection between health and all those entities that are involved in caring and providing health services for our community. And so public health sort of serves as that intersection. We bridge both worlds. As the health officer, what do I do? Well, and this is what I'm responsible for. And essentially, I mean, I am incredibly lucky to be working with great staff and great people in the Spokane Regional Health District. But we're responsible for essentially both assuring the public's health, assessing the public's health, and then also fundamentally providing guidance around policies that really at the ground level are going to have the most impact on our population. As a clinician, I work with one person at a time. In public health, we work with populations. And with elected officials who are able to actually create policies, I suggest to them that they have some of the greatest impacts on truly impacting our populations. And so when I talk to them, I ask them rhetorically, I said, ask yourself when you are crafting legislation, how will this work that you're doing either directly or indirectly affect the health of your constituents? If they can keep that sort of concept in their mind's eye, then I think that maybe it might give them a little different perspective than what they may have traditionally oftentimes brought to their legislative dais. So the Spokane Regional Health District, we're involved with obviously promoting health. We're out there encouraging active transportation. We're also ensuring that, you know what, the water that we drink, the food that we eat, it's safe. I've had the benefit of going off and doing school inspections. I've inspected pools. I've gone on and done an on-site septic system. evaluations. Those are all the things that we do behind the scenes that people don't realize is sort of our work 24/7. So this organization obviously is really there to ensure that in the time of an emergency, that infrastructure exists so that people can, at some level, rest assured or believe that their safety is therefore being factored into the considerations. So, you know, again, for me, it's just an incredible honor and a privilege to serve as a health officer. I have learned a lot. I have so much more to learn. I mean, 9 months, I've been on the Board of Health, as was mentioned, for 8 years, but that's sort of outside looking in. Now I'm really inside and really understanding all the good work that we do at a ground level. And so I wouldn't be able to do anything if it wasn't for my staff, of which I see many here throughout the audience. Again, I've been incredibly fortunate to be able to work with such good people. And I think the work that they do, the work that you do collectively, really assures us that we will be able to create the conditions in which people really have the opportunity to be healthy.